Motivated by our desire to be a world-class producer of coal and its related products, we have since inception in 1899 prioritized safety and health of our workforce. We have made it part of our business strategy to take a holistic approach to health and safety with a mission to protect and care not only for our people but most importantly the host community. As we conduct our business, we are always guided by the need to act responsibly in our operation at all times. The safety of our employees has over the years remained top priority and pivotal to our success.
We concern ourselves about the safety of our employees, about the health of our employees. This is particularly important in these days when we've got this rise in non-communicable diseases. Our program, the wellness program, is geared towards addressing the lifestyle issues that have got an impact on the well-being of our employees.
As Zimbabwe's leading coal producer, our aim is to improve the health and wellness of our employees and their dependents by managing their health risks while simultaneously providing access to comprehensive occupational, preventative and curative healthcare facilities.
We've got quite a number of facilities which have always served the purpose of wellness for the part of the employees, and also on the part of the medical side there have always been some wellness initiatives in terms of testing, in terms of certain health campaigns, etc. But however, I think what we now need to do is to ensure that we formally consolidate everything, then we implement it, then everything which falls under wellness is also catered for separately.
Wellness is very important to us as Hwange Colliery Company Limited. In 1948, the World Health Organization defined the health, as a state of complete physical, mental, and social well-being of an individual, and not merely the absence of disease or infirmity. Meaning that if you are not okay psychologically, you are not healthy. So our wellness program really, attempts to address most of these issues.
With the guidance from our dedicated management team, we have committed ourselves to developing and implementing comprehensive and integrated occupational health and hygiene programs which are consistent with the requirements of ISO 45001 of 2018. We are proud to have embarked on a journey towards attaining the ISO 45001 of 2018 and are alive to the fact that every expedition starts with a single step.
The executive of this company fully understands the importance of this program. I happen to have a medical background myself, so I obviously understand the meaning of this wellness issue. What we are trying to do as the leadership of the company, as the executive of the company, is to lead by example. We'll be leading from the front on this. When it comes to things like exercising and so on, we are going to be leading by example.
We have been doing these programs as Hwange Colliery, but they were a bit fragmented. What we have done as an organization, we have brought all these things in a coordinated way, and in a way that will be able to measure as time goes on. So we are hoping that it will help the employees, it will help the organization achieve its goals. Remember, part of the goals for the organization is to see a healthier workforce as while we are producing coal safely.
We have developed a comprehensive worker-centered wellness program, which we are confident is critical in our pursuit of ISO 45001 of 2018 certification. The Hwange Colliery Company HCC's Workforce Wellness Program, which has been dubbed KaLife Kamushe, focuses on, among other things, mental health services, screening of NCDs, medical surveillance, physical fitness, financial advice, and retirement education.
Our wellness program is taglined "Our Health, Our Wealth." So that's what we're running with as a company. When we're saying "Our Health, Our Wealth," we're not looking at it as in just the individual. We're also looking at it as a company. When we are a healthy workforce, we're able then to have a healthy, productive life also as a company. And our program is called Real Life. So when we're bringing in Real Life, we've had roadshows that have come up. We've been talking about it in meetings, in our safety talks. We've talked about Real Life. The response that we've got is that people want it. They have wanted it for a while, and now that it's coming up, there's a greater acceptance. So one thing that we want at the end of the day is that the program should create some form of reformation in terms of culture and a transformation in terms of the lives of the people that we're working with.
This program is actually divided into categories. We know that employees, there are those who have not yet acquired any form of medical condition, and there are those that already are on medication or they have medical issues. So we categorize that into three categories: the primary, the secondary, and the tertiary health program. When we talk of the primary health program, basically we are talking of those employees that we think they are fairly healthy. So for those, we really focus on encouraging them to continue exercising frequently and to maintain the good health. That's where we encourage mainly on health eating, exercise, and so on. Then for the secondary health program, this will mainly focus on risk factors that predispose employees to certain conditions or certain diseases.
We have set up a competent team to oversee the rollout of the program and have also identified departmental champions.
When we're talking about ownership, we've come up with a program where we want volunteers and not necessarily pinpointing someone and saying, hey, you become a champion. We want people who volunteer to become champions. When a person volunteers, in terms of actually accepting and a greater buy-in, a person becomes responsible for their own actions. Wellness is mainly a lifestyle issue, so it's a choice. We're not going to be forcing anyone, although there will be times where we actually require the workforce to come through and actually get issues like our pre-employment examination. Those are a forced method, whether you like it or not, it's regulatory. But when it comes to the rest of the programs, it's on a volunteer basis. Our champions are going to be volunteer based. They are the ones who will be coordinating these programs at departmental level.
Our valued stakeholders and employees who graced the Workforce Wellness Program launch held on the 6th of December 2019 expressed their commitment to the success of the initiative. The launch event saw the employees and our partners engaging in different wellness activities such as fun run, tug of war, and Zumba dance.
Today it's a good day. We are excited, we are happy. As you can see, as you're witnessing, employees are happy, the community is happy. So basically today we are launching our wellness program as an organization, HCCL, and we believe in the wellness of our employees. And if our employees are well and are healthy, that's where our wealth lies as an organization. So that's why we are here and we're pushing this motive, and we're not stopping.
I'm glad the turn-up was okay from the employees and also interested stakeholders. As you can see, I participated in the 5-kilometer run. I did well. We had a lot of people who came and participated. Remember, the goal is about health issues. It's about the NCDs that we are picking, non-communicable disease that we are picking as an organization. We are hoping that we will try to manage those as soon as possible.
The company wellness committee has been pivotal in ensuring the buy-in of the program by our workforce and the community through carrying out wellness awareness outreach campaigns. As part of strategies to measure the effectiveness of our programs, we have committed ourselves to conducting constant and periodic evaluations of our initiatives.
The idea which is there is to say most partly periodically, maybe say every quarter, we also need to come up with monitoring and evaluation strategies so that at least we see the value that we're going to derive as an organization vis-a-vis the costs that we have sunk in terms of this initiative. Then also again, we also need to check even again in terms of employee participation, in terms of your rate of turnover, even in terms of productivity, or even in terms of overall organizational performance?
We want this program to improve. We always talk of continual improvement. We want this program to continue to actually improve. Obviously, we will need to be benchmarking with organizations of comparable nature. We learn from others. We know of organizations that have done very well in these programs.
I would want to believe that we are going to have a very, very, very significant improvement in terms of wellness, and this is mainly driven by the participation of management.
As part of efforts to ensuring the success of the wellness program, we have invested in upgrading our company hospital and associated health services. The diagnosis, treatment and reporting of pulmonary tuberculosis (TB) continues to receive the highest priority. Under the KaLife Kamushe program, we have also committed ourselves to reviving the sporting and fitness programs, as we believe they do play a part in human health. Workers will be expected to take part in all wellness and sporting activities.
Our management team has given their commitment. The resources are being availed. The onus then lies in each and every worker at the end of the day. The program itself may be starting now, as in we're calling it KaLife Kamushe, we're starting now. But it should last the life of mine, whether we are there or not 10, 15 years from now, it should continue running. But it starts with the attitude that our workers have. And that attitude comes where you're saying, do you want to have a greater life? Do you want to have a better life? Do you want to improve your own self? So it starts with us.
We are talking about issues to do with mental health. We are talking about issues to do with nutrition and diet, for our workforce. We're also talking about issues to do with financial advice, legal advice, retirement education. We're talking about medical surveillance programs. We're also talking about screening for non-communicable diseases. These are diseases such as hypertension, such as diabetes, which are the silent killers.
As a responsible corporate citizen, we have religiously complied with applicable laws and conventions that include National Laws of Non-Communicable Diseases (NCDs). We have also made it our priority to promote positive lifestyles through educating and informing employees and contractors in support of prevention, care and anti-stigma programs.
As managerial employees, we welcome it very much. The enthusiasm is very high. We expect more so that we can benefit health-wise for us to live longer. It's a very good move as far as we are concerned.
We are excited about this wellness program that has been brought to us by the organization. We notice it's important to us as the workers, since a healthy employee is a productive employee. We hope we're going to benefit from everything that's going to come out of this.
First days are really, the workers really wanted to understand what it is, that the animal that we've just introduced. But I'm glad to say overall it has been taken up well throughout the organization.
It's not just limited to the interests of Hwange Colliery Company. We want to also make our own contribution to the nation of Zimbabwe by contributing towards the health of the population of Zimbabwe.
As we embark on this journey towards ISO 45001 of 2018, we draw our inspiration from our core values of teamwork, passion and continuous learning. We will continue to take a holistic approach that gives us a broad view of the link between safety and good health, both mental and physical. Our aim as Hwange Colliery Company is to help people take better care of their health and recognize when they need support.